Just a quick demonstration to show you how to complete an elective procedure booking for renal and transplant patients in EPR. On the left hand side of the screen, just go to requests and prescribing as normal. And to find the right procedures in the surgical catalogue, click on the folders button at the top of the screen. And then if you select the surgical catalogue 2022 folder, you'll see all the different surgical specialities. The two that we're interested in are dialysis access surgery, which lists all of the vascular access and peritoneal dialysis access procedures, and the transplantation folder, which lists more general transplant and post-transplant procedures. You'll notice that in these folders, every procedure has got the S in brackets after the procedure name. Any procedure that you're booking for theatre that's in the surgical catalogue should have that S in brackets after it, so don't select anything that doesn't have that. So when we select our procedure, you won't see this error for a patient that's got a current encounter. You will then get to the OEF itself, so this is the order entry form. So you'll be asked to complete the procedure free text and laterality. If the laterality is not relevant, you can put not applicable. If there is a left or right side, then please write it in the free text box and select it in the confirm laterality box. You can select the consultant surgeon, and the correct consultant surgeon should appear. For the surgical area, always select Churchill Theatre's main, even for cases that you think might happen at the Foscot. Book them under here and they'll be moved to Foscot lists as they're allocated later on. If a particular surgeon needs to do the procedure, then select the surgeon's name here. If it's to go to a pooled operating list, then please just leave that field blank. You can complete the rest of the anaesthetic fields. If a patient requires a pre-op assessment, I'm going to select no so that just for this procedure doesn't go onto the list. Priority, so routine is generally within 6 weeks, urgent within 2 weeks, well actually urgent's within a month usually. Whether the patient is diabetic, does the patient require transport? If you don't know, you can select unknown and the booking team will check. Surgical speciality field is really important. This is the field that determines which waiting list the patient goes on to. So for our procedures in renal and transplant, please select either dialysis access surgery for PD cases or vascular access cases, and then for everything else, select transplantation surgery. Please don't use any of the general surgical specialities when you're filling this out, because the procedure will go onto the waiting list for that speciality and our booking team won't be able to see them. Surgeon grade should usually either be a named consultant if it's a particular surgeon that needs to do the procedure, or a pooled consultant if it can be for anybody. Visit type will usually be either day case or inpatient waiting list, depending on whether the patient needs to stay in after the procedure. If there's anything specific required, so if you need x-ray, C-arm, complete that here, document any anticoagulation, and if the anticoagulation needs to be stopped, just put that and any other comments for the booking team into the additional comments section. Once you're completed and have filled everything out and there are no yellow boxes left, you can click sign. That will then bring up the RCS prioritization form. For our surgeries, most procedures for vascular access and dialysis access are going to be P2s, hernias and other less urgent procedures will be P3s. When we do that, usually you'll select no harm to the patient at this stage and click that, and now the procedure's been placed and you will be able to refresh and see that procedure is now sitting on the waiting list, and the booking team will be able to pick that procedure up in appointment book.